Okay, so hello. Today I would like to interview Dr. Hannah Rockman, who is a clinical neuropsychologist, about the process of the assessment for children with ADHD. So thank you, Hannah, for doing this.
Pleasure.
And the first question I want to ask you is, when should you consider diagnosing your child?
Well, we usually consider diagnosing a child, or anybody for that matter, is when the symptoms start interfering with their functioning. So in terms of learning disabilities, if we're talking about those, or if we're talking about attention problems, they usually appear mostly when they start school, unless it's very severe, in which case they will appear even prior to that. But once in school, the children need to fit in with a very rigid schedule and expectations, which they don't necessarily have at home, where the rules are often more flexible. And that's when the problems arise, and you can see that they may be academically floundering, they may be disruptive in class, they may seem to have no motivation, they may be asked to leave class more often than you'd like, and you may start getting calls from the teacher or the principal. That's when you need to start thinking about an assessment.
Okay. And so what is the first thing that you think they should do?
Well, the first thing you need to do is check whether their hearing and their sight is okay, because sometimes children just need glasses, and that's why they can't pay attention, because they can't actually see what's written on the board, or possibly they can't hear properly. So the first thing we would always do when we see a child for an assessment is to ask the parents, have they had their hearing and their sight checked? If they have, and there's no problems with that, and there's no medical problems such as possibly anxiety disorders or some physical impairments, like maybe chronic stomach ache, that might also interfere with their ability to function at school, then the next step is to determine if they have a possible learning disability. And a learning disability is really based on the fact that a child would be at least of average intelligence, and then that there is something that, despite them being average or possibly above average, they are still below their peers in terms of their academic achievements and their ability to follow what's going on in school. And that will raise a red flag both with the teachers and with the parents. The other issue is that you want to make sure that this is a behavior that can be seen in different settings, particularly with attention. So, for example, if a child pays attention at home but is only disruptive in school, or is only disruptive at home but not at school, then there might be a problem with the environment and not with the child themselves. So you need to look at those factors as well. But let's assume that the child has difficulties at home trying to do their homework, or at school they're falling behind, they seem to not really understand or lose interest in what's being taught, and the teacher is also noticing this. Then the next step would be to see a psychologist for a psychoeducational assessment.
Oh, right, but I'm talking about the assessment of ADHD. So,
Right. Well,
can they go to a family doctor first?
they can go to a family doctor first. The issue with ADHD is you need to decide whether this is an issue of attention. Are they not learning because they're not paying attention and therefore they're not taking in the information? Or are they not learning because they have a learning disability and therefore cannot pay attention because they're not processing the information properly? So we would recommend doing a full psychoeducational assessment, which would include a component of the attention
But
and
if there are no
possibly
problems at
anxiety.
school,
Sorry?
if there are no academic problems, but a lot of behavior issues. So do you think
It's very rare that there are absolutely no academic problems and the child pays attention and does their homework and is not disorganized and follows instructions and is not distracted, and they only are disruptive in their behavior? That's very unusual for ADHD. And you may find that they're not even disrupted. You may find that they're just daydreaming in school.
Right.
In which case they often fall through the cracks because they don't make problems for the teachers, so they just ignore them.
Okay. So what should they expect when they come for a psychological assessment?
Well, a psychological assessment basically looks at various aspects. So the first thing we look at is the general intelligence. And so we will check the various capabilities in learning, first their verbal learning, their visual learning, their memory, their short-term memory, their ability to process information. And that is tested first. And then the next thing what one looks at is the academics. Because for a learning disability, there has to be a big enough gap between certain aspects of the ability to learn. For example, a child with ADHD may have very good intellectual skills, so they may be very bright and be able to read and write and learn, but they have a lot of problems paying attention and remembering detail, and that will come out in that sort of test. The next thing you want to look at is the academics. And so, because if they have a learning disability, but it has no effect on their ability to learn, then it's not really a disability, it's just their particular way of learning. So the next thing you would do is you test their academics, reading, writing, spelling, comprehension, mathematics, and the speed of learning. And you want to determine whether they have any deficits that might be related to the deficits that you have found in the earlier test for intellectual functioning. Beyond that, you will also give tests that are specifically related to attention, and they may be processing tests, which we will do on the computer for them. They may be surveys that we'll give the teacher and the parents and the child if they're old enough, because again, the ADHD diagnosis has to occur in one or more settings, two or more settings rather. So maybe home and school or school and camp. But if it only happens in one setting, then it's likely more to do with the settings. So that's why we have to collect a very, very detailed history, both from the parents, later on from the teacher, that teachers that have taught them for enough time to know the child well, so that you want to look at their behavior in school, how they interact, how they process information, are they having difficulties following instructions, and so on. And those are questionnaires that are given, plus a test for attention in the office and during the assessment itself. We will also do some emotional tests to make sure that anxiety is not getting in the way of attention. And then so the tests, depending on the age of the child, testing is usually between 6 and 8 hours. If the child is younger, we'll do it over 2 or 3 sessions. And then, of course, we have to analyze all the results and then write the report and make a diagnosis. And then we'll provide recommendations for the school. At that point, the school will do an IPRC, which is placement meeting, which has the school psychologist, the head, the principal, the teacher, and the parent, and they will determine what issues need to be seen right away. And then from that, an IEP, which is an individual educational plan, will be put together. The IEP holds the school accountable for what they promise to the parents to provide for the child.
And can they have that IP without an assessment if they need?
No, because the school needs more funding from the government to provide extra help, and they will not get the funding if there's no diagnosis. And it's the same for children going to university. This kind of assessment needs to be done every 5 years. So if you do it in grade 1, you'll have to do it again in grade 6, and then again in high school for university, for them to continue to get accommodations.
Right. And they can be assessed at the school.
That's right. It can be assessed at the school, and that's free. The only problem is that there's usually a 1 to 2 year waiting list for the psychologist at the school to see them. And so most people who have extended health care, which covers this type of assessment, will go privately.
Right. Okay, thank you very much for your time.
You're very welcome.